Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm your host, Logan Plaster. It's my pleasure to be here today with Pinaki Dasgupta, CEO and founder of Hindsait. Pinaki, good to see you again.
Same here. Great to see you, Logan. It's been, I think, about a year and a half since we are meeting.
That's right. I think maybe in Miami we might have done an interview.
Yes, absolutely. Yep.
So you're innovating. I love what you're doing. You're innovating by using big data to eliminate or cut down on wasteful spending. In my mind, anything that cuts down on wasteful spending in healthcare is a good thing. So tell us what you've built with Hindsait.
Yeah, not only just eliminating wasteful spending, but to do wasteful spending, payers end up spending big money just to do those reviews and audits by hiring nurse and docs who will go through the records to find whether it was wasteful. And that's where we are even eliminating additional operating cost for payers.
Okay, let's break all that down. So for an audience that's just not in the industry at all, maybe they're in healthcare, they know that they want to break down wasteful spending. They know that they want to spend every dollar possible on actual patient care. So walk me through an area that's a common area of waste and kind of some of the ways that Hindsait steps in.
Yeah, so one of the key areas is utilization management. And the way the healthcare addresses the issue is by payers doing prior authorizations.
Okay.
And also a lot of prepay audit happens for genetics, urine drug test. Even before the claims get processed, they actually run an audit. In all such audits, they will request the provider to send the actual clinical data of patients, and then they will go through the records to ensure that there are enough evidence that services that was rendered were necessary.
Okay, so how does your software speed up that process or make it better?
Yeah, so this is like going through hundreds of thousands of pages and literally looking for a needle in a haystack.
Okay.
Right? So we make that process seamless. We could automate that process. So we will say, let's say 30 to 50%, you don't need to audit it, you don't need to review it. Our machine learning and AI capability, machine can learn and can mimic the decisions of humans. And so 30 to 40%, right out of the gate, we can automate without a human touch. Okay. We can say, there are enough evidence found in these records and you don't need to review it. And anything that is, it's not a slam dunk, we will offer it to our reviewers. But what we do is, rather than reviewers flipping through hundreds of thousand pages, in one click we could get you to the page where those information are stored.
Interesting. Okay, now you're not a new kid on the block. You've been with Startup Health for 8 years and you've been in this business a while. Tell us a little bit about your kind of the big milestones over the last decade in terms of traction.
Yeah, it's a very, very interesting journey. Yes, we started in 2013. This year, we actually celebrated our decades of relationship. It's great that I've been paying myself for the last 10 years. And it's been a fascinating journey. Healthcare is fascinating. A lot of innovation is happening today. When we started, AI was not an accepted term. Your big data was, but now AI, of course, suddenly everybody's talking about Gen AI. They're talking about LLM. So it's getting very interesting. So we receive a lot of calls today from clients, and I see a lot of interest actually, even in our social network. That, hey, you guys have been there for last 10 years, and now suddenly, it's like a huge boom. So
is that actually translating into partnerships and clients, or is it just more excited conversation?
Healthcare, nothing happens overnight, as you all know.
Sure.
So it's not like, everything, I'm just getting checks coming in through the door. No, that didn't happen. But there are a lot of good conversations happening and quite a few pilots underway, and we are seeing application of our platform in very different industries that we did not touch. Oh. And when I say by industry, started with third-party adjudicators, benefit managers, moved into very large health plans, and now we are moving into MACs, Medicare, contract administrators, who are managing the claims for multiple Medicare beneficiaries across the United States. And And the new opportunities that is open up is, worker compensation, for example, auto accident. Some of these areas also requires them to go through the medical record to ensure that worker compensation is appropriate. Certain accident related injuries and the payment associated with those are appropriate, and we are seeing some new use cases for our applications that we built originally for payors.
Interesting. Okay. I want to sidestep a second and make sure that we're clear on this idea of waste and educate our viewers on how much waste there is in healthcare based off of your experience, and kind of maybe put them in buckets, like understand where the waste is.
Yeah, so there are numerous studies done, and Health Policy Brief did it, and everybody came to the conclusion, about 30% of healthcare is wasteful and could actually be eliminated.
Yeah.
So if you look at the pie, that's translate to over $1 trillion. Healthcare now is, $4 trillion in the United States. So it's over $1 trillion. And one of the pieces is this administrative inefficiencies, like this prior authorization, risk adjustment audit, CPT audit, DRG audit, all kinds of audits and reviews. That actually takes a lot of the core healthcare provider, doctors, nurses, to do nothing else but reviewing records to find appropriateness. And that, I think, is a drainage. And by using AI, we could automate, we can augment these processes, and that's been our journey so far, and we like that.
Yeah. So what's next for Hindsait?
So the next is, next year we'll be raising capital. So far, we kind of did raise a small seed capital, and we have been self-funded and revenue generating, of course. Thank you.
Always a good thing.
Yeah, but now I think I am seeing explosion of our technology adoption in the marketplace that is coming. And to be ready, I need to invest in sales, marketing, and broadening our team.
Yeah.
And so next year, I'll be raising funding and expand our footprint, have sales and marketing to pound the pavement and bring more new clients.
How much of an advantage is it to you to have been a first mover in a market that I'm guessing now is getting more crowded?
It is getting crowded, yes, and even in the bus when I was coming here, everybody says they are AI. So I don't know really, what is AI, what is not. But yeah, I think there is we started when no one really was talking about AI, and today we had processed almost 35 million records in healthcare. And so the advantage that we have is our algorithm is way advanced than people who are now coming in.
Yeah.
And this learning of last 10 years, it could catapult to the next layer of our growth.
Got it. That's awesome. Okay, Pinaki, always good to get an update from you. I wish you the best as you kind of figure out what that next big move is, and as you cut out wasteful spending in healthcare. So thanks a lot.
Thank you.